Hello everyone, it's Menno, and at last I present to you Facial Feminization Part 2. I put Part 1 up July last year, and apologies that it's taken me so long. So much keeps happening and I get distracted very easily, so sorry. Part 1 focused very much on a thing called gender markers. A better word would be sex markers. These are the things about our face that give away whether we're male or female. In this video, I'll be looking more at the actual surgical side of things and the business side of things. I'm also planning to do a part 3, which I'll call the Mirror of Lies, which is all about how these services are being marketed to men so keen to claim womanhood. I also want to do a part 4, where I really want to delve into what does it mean for women and girls when womanhood is being commodified and capitalized on via facial feminization surgery. So for all my female viewers, please let me know your thoughts on this. How do you feel that surgeons offering WomanFace to men claiming womanhood is affecting women and girls? Please let me know in the comments, and then I'll base part 4 on your thoughts. Okay. Let's go! Facial Feminization, Part 2. Facial feminization surgery is serious business in many ways. It's serious because it's quite radical and very aggressive surgery.
I'll start shaving this bone here. So the orbital rims with a saw.
With
a saw.
Okay.
Depending on the procedures that you sign up for, it can be anything from 2 to 9, even 10 hours, as it did in the case of Bruce. The word aggressive is also used by Dr. Oosterhout, who is considered to be the father of facial feminization surgery. He pioneered many of the techniques and started performing them on men in 1983. He wrote a book about it, in which he uses the word aggressive consistently to describe these surgeries. Here's an example. This is very aggressive skeletal surgery, no matter which procedures you undergo. He also calls his book a consumer guide rather than a patient guide, which I thought was interesting. Oosterhout came up with FFS in response to demand from males who identify as women who had had the surgery done. They'd go through life and the world, surprise, surprise, would still think of them as a man. Which makes sense because in day-to-day life, it's your face that's on show, not your genitals. Although, of course, there will always be some exceptions. There has been a shift from genital surgery to facial surgery. Last year, I spoke with someone who had had surgery on the face, and they said themselves, I'm working my way from the top down. So what actually happens during the surgery? This is what Wendy said about the surgery that he had coming up. So the surgeon is going to make an incision just above the ear here and then cut all the way across along the hairline to the other ear, and that way he'll be able to pull my face down basically and shave the brow bone because I want that to be nice and flat. He'll then also perform a nose job and then basically pull the skin back up, but pull it up higher so my eyebrows will be higher, and he'll also pull my scalp forward to bring the hairline forward so that overall my forehead will be quite reduced in size because women have smaller foreheads, so that'll be a lot more feminine. He can then use some of the dermis from the skin that he'll have cut from my forehead and use that to plump up my lips. He'll also pull my upper lip up a bit to reduce that space between the upper lip and the nose. And then to finish off, he'll shave down my jaw, which he can actually do from the inside. It doesn't sound too dissimilar from the facial surgery that Donna Rose had. He started life as David Rosen, was a wrestling champion, married, had a son, and at the age of 40 had his facial feminization surgery in a bid to become the woman of his dreams. He is one of Dr. Oosterhout's patients and also wrote the foreword for Dr. Oosterhout's book.
So I've had my face completely rebuilt, removing the skeletal traces that men have in their faces.
His first facial surgery took 13 hours. He had a nose job, a chin reduction, jaw shave, brow bone shave, a brow lift, scalp pulled forward, and his Adam's apple shaved down. He also had a number of follow-up surgeries, including a forehead revision to deal with his receding hairline, a hair transplant, a lip lift, lip shortening, lip filler, cheek implants, and an upper facelift. All this to look like a woman, or in Donna's own words, to fit into the box that society expects of women. Wow, thank you, Mr. Man, for reinforcing the social constructs that have been oppressing women for years, claiming womanhood on the back of it, while also reinforcing what a man cannot be. But I guess the surgeons are happy with your repeat business because it's serious money. Depending on which procedures you go for, you're looking at anything from, in the States, $20,000 to $50,000 and up. David spent about $32,865 smackaroonies. There's a clinic in Antwerp, in Belgium, where costs range from €5,000 for a single procedure to €40,000 for more comprehensive stuff. This is where Monroe Bergdorf had his face done.
The operation that I'm having costs around £7,000.
Rodrigo Alves went to the same place, but spent quite a bit more, £25,000. Woman face. Which man wore it better? Woman face. Which man really looks the part? If you'd like to get more information on the market size for facial feminization surgery, there is a report available, but it does cost just over $5,000. What will you spend your money on? A brow shave or a report? FFS actually, within the trans community, is very controversial, and one of the reasons for that is the cost. The costs are astronomical. So this type of surgery is only available to those who can afford it, which is why we're seeing more and more crowdfunders for FFS pop up. So yes, FFS involves quite a bit of money. For some, this would be an annual income, but the men undergoing these procedures would argue that it's the best investment of their life because it will help them for the rest of their life. And some might even say that it would in fact save their lives because they've got serious issues. David, or Donna, talks about being consumed by questions and the inconsolable anguish of looking into a mirror day after day and year after year and seeing an imposter there. What? Who are you? I am you. No, you're not. Get out of my mirror, you imposter! Oh, for fuck's sake. FFS? That's it! Monroe Bergdorf, previously known as Ian, seems equally obsessed and dissatisfied with his reflection, saying he felt he wasn't seeing who he really was. Even after years of using fillers and Botox, he says, that still didn't give me the face I really felt was mine. He describes freaking out in dressing rooms if the light hit his brow ridge the wrong way or showed the width of his chin and nose, and asking, how am I going to look at myself in the mirror without makeup? It got so bad for him that he was afraid to leave the house, and FFS became crucial. And then we have Ellie, who managed to raise just over £30,000. He talks about having massive dysphoria in everyday life and being desperate. And then there's Zara, whose fundraiser was unsuccessful. Zara talks of mental torture and being perceived to be female, not even trans, as being the only thing that will stop him from wanting to commit suicide. That's some serious stuff. I don't think anybody would deny that. The question is, where does it stem from? And does it make a man a woman? You could argue that these people are actual women trapped in men's bodies, feeling the distress from that as a result. And on top of that, the stress of living in a society where others don't see the woman inside, but they see the man. But if you believe that, you're going to have to explain what that means to be a woman inside a man's body. Or you could argue that these are men who are suffering from intense self-hatred, feelings of being a failure as a man, having an identity disorder, having body dysmorphic disorder, perhaps internalized homophobia, over-identification with sex stereotypes, perhaps autogynephilia, perhaps narcissism, perhaps a combination of these things. None of these things, of course, make a man a woman, and neither do the surgeries and the medical treatment that they pin their hopes on. They're simply men with issues. Welcome to life.
Welcome to your life.
One thing I've noticed is that these men are very keen to stress that facial feminization surgery has nothing to do with vanity.
This surgery isn't to make me more beautiful, it's to put my mind at rest.
Because these surgeries, even though it's hard to explain, were not done for vanity. They were done to alleviate gender dysphoria.
It's not to conform to cisgender female beauty standards, but rather to alleviate feelings of gender dysphoria.
Some go further, claiming it shouldn't even be considered to be cosmetic surgery.
I want to emphasize that this is not a cosmetic surgery. It means a whole lot more to me than that.
And some put it on par with surgery that people have who have facial disfigurement because of a congenital condition or because they've been in a terrible accident. Saying it's got nothing to do with vanity, I'm not buying it. The person I mentioned earlier who said they were working their way from the top down, who'd had their FFS, told me a story about how a few months after, when their face had healed, they went for lunch with a good friend of theirs, a male friend, a bloke. And this apparently is what the bloke said. Yeah, you pass as a woman now. An ugly one, but a woman. Sorry. Which, I guess, is not the most diplomatic way to put it. But hey, at least he said you pass as a woman, right? The guy who had the surgery done wasn't pleased at all, as you can imagine. But it did make me think, okay, so it's not enough for you to pass as a woman. You want to pass as a pretty woman. He got very angry relaying that story because earlier in the conversation he'd said that for him, passing, he said, it's all I ever think about. I don't think that's healthy, which brings me back to these are men with issues. After Wendy had told me all the stuff that they'd be doing to his face during the surgery, I asked, how are you hoping to feel once your face has healed? And Wendy just said, I just want to feel prettier. So this thing about vanity having nothing to do with it, nah, I'm not buying it. Here's a guy who's a little bit more candid about why he went for FFS.
The truth is, I don't just want to look female. I want to be beautiful. Desperately. I want to see myself in the mirror and think I look snatched. Is that a crime? I'm a girl.
Anyways, let's leave it there for now. In the next video, I'm going to be looking at how surgeons are selling these services to these men. If these surgeries may all be in vain, how we are all brought into their surgeries and validating the results. How that jars with our own natural instincts to be able to spot someone's sex. And most importantly, how does this affect women and girls? So, let me know what you think, what your thoughts are about all this kind of stuff yourself. If you're saying, hey, they can just do what they want, it's their bodies, their money, it doesn't bother me. Or if you're kind of thinking, especially, I want to hear especially from women, if you're thinking, whoa, yeah, this is kind of freaky because, I just feel like they're appropriating femaleness and they're trying to copy our bodies. It'll be very interesting to see your thoughts on that. All right, I'm gonna leave it there. Okie dokie. Ciao, ciao. Bye. To all my PayPal and Patreon supporters, thank you so very much. Special shout out to my big spenders, Helper Open, Mama Turv and the Turvin Teens, Dark Horse, The Lovely Mary, Me Julie, Julia, JPH, and Stephanie. Thank you.